Hi, I'm Sue Menor. I'm one of the lactation consultants at the Mercy St. Vincent Medical Center, and I'd like to show you some of the various pumps that are available in the Mercy system so that the moms will be able to utilize these well. This is the Symphony breast pump, the Classic, and the Lactina. It is vitally important for the long-term establishment of breastfeeding that mom begins pumping within 6 hours of delivery if baby is unable to go to breast, and that is now hospital policy. We would like to show you the breast pump collection kit and how to put that together and utilize that with the pump. I'll introduce Helen to show you that.
Hi, I'm Helen Wild, one of the other lactation consultants here at Mercy St. Vincent's Hospital. I'm going to show you how to set up a breast pump kit with a breast pump, and we're going to talk a little bit about the Symphony and then move on to the other pumps in a little while. This pump can be found on the cart within the clinical room on 7C. It is also found in the NICU and on the children's floor too. So we're going to open the pack and take out all the pieces within it. Whoops. There we go. So firstly, this is what is contained within the pack itself, and you'll see there's multiple little pieces. It looks very complicated to put together, but in fact it is very, very simple. And when showing a mother, obviously you want to be able to show her that everything comes apart for washing and cleaning. Very, very simple. And when you're putting it back together, you can't go wrong because every part only goes in one place. For example, the bottle will not go in the wrong place. It'll only go in the right place, which is at the bottom here. So everything has to be washed after each use, apart from the tubing system. This never ever should be washed. The reason we don't recommend this is because it is impossible to dry it completely. But everything else is completely washable. And at the hospital we don't use our soap because it is full of chemicals and is more dangerous to the baby and is not recommended because it can destroy some of the valuable properties within the breast milk. So we just use water. Tap water is absolutely fine, suffice. Very, very important, though, is that she dries the equipment thoroughly with a paper towel, using the paper towel dispenser, and that way you will protect the equipment and look after it. When she gets home, if she wants to, she can steam sterilize all this. She can also wash it in hot soapy water. That is quite acceptable. But for the 2 or 3 days during her hospital stay, we recommend she just uses tap water. Okay. So firstly, we have very, very small bottles, and these are nice for collecting the first milk, the colostrum, because they're very tiny, and you really don't want to overwhelm a mother by giving her a big bottle. It just daunts them. So we always start off with the small bottles. You'll see that there are several sizes of what we call flanges, and this is a 24 millimeter, and you can just see on here very, very, very subtly, it says 24 millimeters on the inside of this flange here. And this is a bigger flange, you can see by looking at it, but it does have the writing on the side here. This is a 27 millimeter flange. And within the unit too, we have a 30 and I think a 32, if I'm mistaken, and a 36 millimeter flange also. Okay, but Mrs. Average typically starts with a 24, and you know, during her lactation, she may have to switch sizes. It just depends. And we're looking at the nipple size here. This is the diameter here. And we're making sure that the nipple fits central within to the flange and it fits comfortably and there is no pinching during suction. Okay, that is very, very important. And of course, when lactation are available and they see the mother the following day, they will assess to make sure that the right size is being issued out to that mom. Okay, so how do we put it all together? Well, there's a little valve here. Now, they do give you a spare set within the bag here, 2 little valves. And the reason they do that is because after some time they can tear. They can also go down a plug hole, just get lost because they're very, very friable and small. But they don't need to really to be changed unless it is damaged, okay? So that goes in here. And then the flange, the part that goes to the mother, goes here. The small bottle is going to screw on here. just try and screw it all together nicely. Okay, and we're good. That's one. Now, if the mother is well and able to sit up nice and upright, we do recommend that she pumps from both breasts at the same time. That way she gets maximum stimulation. It is also much more time effective. We don't really want her to be having to do one side at a time unless she really insists. It's much more efficient, much better for her hormones. The pump we're going to talk about right now is called the Symphony. To open the top, you just press the button here and lift up the lid. And you'll see there's two domes in here. The on-off button is right at the front. And you can see that the caps are going up and down here. So you want to make sure it's all working effectively before starting pumping. Okay, so I'm just going to set that up. Put the two caps in, make sure they're pushed down firmly, and close the top. Okay. There's a small hole at the back of the equipment here. That goes in there. Push it in firmly, and she's ready to go. Okay, so you turn it on. You turn the suction level up to a comfortable level for that mother. I can't emphasize enough that it should not be painful, so you do not want to whack it right up to the top and cause her any pain at all. You want a comfortable level that's giving her a nice even draw, as much as she can tolerate, really with no pain at all. And if you listen very quietly now, you can hear it's going very quick, shallow pumps. After 90 seconds, it's going to go into a much deeper, slower suction. If she's very fortunate and she's able to get a lot of milk initially and you see milk starting to drip out, to speed the process up, she can press this drip button here, and this will take her into the second, what we call the letdown phase of the pumping. It's much slower, but it is deeper. So at that point, I do always warn mums, you know, they may want to turn it down a notch or two, and she's going to find her comfort zone. Ask her to take a little note of what is comfortable for her. Have a look at the dial across here, and you can see there's little milk droplets. She wants to sort of keep a mental note of that. Although initially, you know, she may start gently and start going a little bit stronger as time goes on. And obviously, as her milk comes in, it's going to feel less aggressive. It's going to feel a lot more comfortable. And we recommend that she does this between 10 to 15 minutes every 3 hours, night and day. It's critical that the mom pumps during the night. It is not good, really good practice at all to let the mom sleep during the night. The hormone prolactin is highest between the wicked hours of 2 and 5 a.m. And I didn't just make that up, that's evidence-based, honestly. So it's critical that she does one pumping session between 2 and 5 a.m. This is for long-term establishment of a good milk supply. We have a lot of moms who phone us 3 or 4 weeks down the line because they didn't pump at night initially and they ended up with a poor milk supply. So I can't emphasize that enough. If mom is well, she needs to pump. Those first 3 days are critical to waking up all the prolactin receptors within the breast and getting breastfeeding established. And that's how you turn it off, as easy as that. Thank you. Hi, we're going to talk a little bit about the classic breast pump, which is available on some of the floors. Some of the floors do not have a Symphony breast pump, which we just discussed. So now we're going to talk to you a little bit about the classic. You will require a filter, which you can obtain from the warehouse. You have to order these in order to make this pump work effectively. Okay. You do not need the caps that we were using earlier for the Symphony, but tell the patient do not discard them because she may need them at some point later on in her breastfeeding career. Okay, so using the filter and the other connector here, we screw them both together. Very, very easy. Okay, and you'll notice on the end here there is 2 holes. This is where you're going to situate the tubing from the breastfeeding collection set. Okay, now if the mother is unable to pump from both breasts, she can move the cap over to stop the suction and just pump from one side singly. But of course most people, as we recommend that most mothers do pump from both breasts together, as she's going to obtain a much better supply and also very, very quick. Both the ends click in here. You can see they cannot go anywhere else. Okay, very, very easy to do. And then the tube on the end here, which is never removed, connects to this part of the filter. You just screw it in. Well, push it in really more than screw it in. And that's all there is to that. Now, the on-off button is situated here. Turn it on. We're going to set the suction level at minimum initially to start with. During pumping, again, you want a nice even draw. You want that nipple to go in and out, a nice even pace, no pain. Very, very important. It doesn't hurt that lady. And you gradually increase it until you find a level that maintains a good suction without causing her any discomfort. And again, she needs to pump for approximately 15 minutes every 3 hours. And then we'll just turn it off. Okay, finally we're going to talk a little bit about the Latina breast pump. This pump isn't used very often, but it is available to use on the 7th seafloor, and I think in some of the home away from home or the Ronald McDonald House also. So how do we use this? Well, each kit actually does come with a hand pump, okay, which again is not recommended but has to be used very, very occasionally. So this is the piece of equipment she needs for this. She also needs the connector. She's going to screw these two parts together, and you're going to show her how to do that. Now, very, very faintly within the pump itself, you can see it has minimum to maximum suction. Okay, the little dial here does turn to get the right suction for that patient. Okay, and then to do this, we're going to plug it into the Latina. There's a little hole here and it goes straight in there, and then the top part just clips into the Latina across the top. Okay, and it's all ready to go. We're just going to plug in to the Latina. We're going to pump on both sides together. We turn it on here on the on-off button. This little dial here controls the frequency, how fast the actual pumping session is going to be. So you can see very, very slow, gentle pumping, right up to very, very quick pumping. And then for the suction, the amount of pressure that the patient has, you turn the dial here. This white dial goes from medium to maximum. It's in very, very faint. You might not have been aware of it. You turn the dial to find the right level for that patient. So that gives you the amount of suction. If she says it's not strong enough, turn it up for her. And that is all there is to it.
So to recap for you, we would like the mom pumping within 6 hours of delivery if baby is unable to go to breast, and every 3 hours after that, day and night. When she's pumping colostrum for the first few days, we would like her to pump into this container because it has the rounded bottom, which will make it easier to pour from this into this bottle. You can take both sides that have been pumped and pour it into one container. That's fine. Please provide the patient with patient labels, which she should put the date that she started the pumping and the time and any medications that she is taking. This should then be placed in the refrigerator. That's pretty much it.